All right, certainly it's a pleasure to welcome everyone here to Glad Tidings, to South Hayward, Southern Alameda County, and it's always a joy to welcome our guests to our campus here at Glad Tidings. We're honored today to have with us our Congressman Eric Swalwell. Always a pleasure to see him and to have him come to our neighborhood so we don't have to try to make 1,000 phone calls. He came to us, and we welcome him today. We're glad to have him representing the 15th District, I believe it is, here in California. So why don't we begin by just giving our Congressman a great big God bless you, everybody. Honored to have with us Herb Schultz, I hope I'm saying that right, U.S. Department of Health and Human Services, the immediate office of the Secretary and the Regional Director here. And I'd like to ask if he'd wave his hand so we know where he is. All right. And David Rayad is here with us. I hope I'm saying that right. I got that right. David, welcome, the Chief Executive Officer of Terracio Vesquez Health Center here in Hayward, and a very prominent member of the health community here. And let's give him a great big welcome. What do you say? Of course, someone that I know, Alex Briscoe, the health director for Alameda County, is with us today, and we're glad to have him in church. I think there are some elected officials who are here, and I don't know if I know all of them, so I'm going to ask that they would please stand and introduce themselves. And if you are an elected official here in Hayward or Alameda County, would you please stand? We certainly don't want to overlook anyone. Please introduce yourself. Use your preaching voice. My teacher's voice. Oh, teacher's voice, yes.
Mark Salinas, Hayward Mayor Pro Tem.
Thank you. And way in the back? All right. Now, would you look at the person that's nearest you on either side and tell them you're very important and I'm glad you're here? Now, come on. Now, give the person you're next to a great big hand. That's what I'm talking about. Today, there are a number of resources available. I hope you'll make yourselves available to all of those. Resource Fair, the Office of Assembly Member Bill Kirk has a table. DeBercio Health Center has a table there. Covered California is represented. Alameda County Healthy Home Department Initiative is there. Alameda County, Alameda Contra Costa counties is represented with the optometry booth that's set up on the other side. St. Rose Hospital is here. So there's screening available for your eyes, screening available for blood pressure, and I have availed myself of both of those, and I'm here to report that they had a good report, and I can see all of you. So the Vision Clinic is being operated today by Alameda Contra Costa County's Optometrist Society, the Dental, Southern Alameda County Dental Society of California, and blood pressure and glucose by the Unitech College. And thank you to all of you who are volunteering to make this day a productive day. Thank you very much. Well, this is a day that we've come to hear as much as we can, to gain as much information as we can concerning our health system and our health departments in terms of how it's going to impact our lives in just a few weeks from now. And we're thankful that we have enough people here who can give us the information that we need that may allow us to make informed decisions. And with that said, I think we're ready for our Congressman. Would you join me and let's welcome Congressman Swalwell, everybody. Let's give him a great big welcome. That's the way you do at City Hall. But in church, we welcome people a little differently. Come on, let's give him a real welcome. Congressman Swalwell.
Thank you, Bishop Macklin. I need to take Bishop Macklin everywhere I go. Thank you so much. I've been here, sat just over there for your Easter sermon, and I encourage all of you to make it here next year for that. That is surely not to be missed. And so thank you so much. I knew there were a lot of things going on in your church this weekend and on this campus, and to allow us to come here right before October 1st and the Affordable Care Act truly does move forward means a lot to our office, and most importantly, to the people who I serve. I also want to just say I'm looking forward to Bishop Macklin. He's going to be visiting us in Washington, D.C. On September 20th, and he's going to give the opening invocation for the House of Representatives on September 20th, a true honor just for Bishop and what he's been able to do in our community. I also want to thank the participants who are up here, and if you asked me who would be my dream team of health advisors who could talk about the Affordable Care Act, the folks who are sitting behind me today are on that team. And first I want to thank Regional Director Herb Schultz of the U.S. Department of Health and Human Services. Thank you, Herb. Also Alameda County Health Services Agency Director Alex Briscoe. When I was on the Fire Advisory Commission as a city council member in Dublin, I worked on the county commission that worked with Alex, as Alex was proposing at that time having portal fire clinics where you could have our fire departments serve as health portal clinics for the lower acute levels of care. It's an idea that is moving forward. I'm very excited about that, and it's Alex's big brain and leadership that has allowed that to move forward. I also want to thank David Valle he's the CEO of Tiburcio Vasquez Health Center, and also want to thank David for lending his knowledge here today. Some of the folks helping us covered California, Alameda County Healthy Homes Department, Alameda Contra Costa County Optometric Society, specifically my friend Dr. Jennifer Ong, who's here. Thank you, Dr. Ong, and Dr. Yuka Akera, who's helping Dr. Ong, as well as the Southern Alameda County Dental Society and California Dental Association. They're providing health services along with Unitech College. Unitech is here. I think I saw our Unitech. Where's our Unitech representatives? I think they're out there at the booth. Finally, St. Rose Hospital is helping us, and thank you to our elected officials, Supervisor Valle, Mark Salinas, Francisco Zermeño, John Taylor, Assemblymember Wajkowski's office, and I believe we also had Chris Peoples is here as well. It's important, we thought that we shouldn't just present on the Affordable Care Act. We wanted to bring vision and dental and glucose screeners here to help those in the community who need it. And so, again, I just wanted to thank the volunteers. And please go out there and see them. I'm going to encourage some of my members of Congress to visit the Vision tent, but I don't think they offer the kind of vision that we need from some in Congress. But thank you again to our eye, dental, and glucose screeners who are helping us here today. And if you want to sign up for a free clinical checkup, visit the sign-in table at the lobby, and we'll do that. I'm just going to walk through a brief slide show of just what I think the Affordable Care Act can offer. And I'll preface it by saying this. I came to Congress in this past January. When I arrived in Congress, the Affordable Care Act had been passed by Congress, signed into law by the President, and upheld by the highest law in the land, the Supreme Court. As far as I'm concerned, having been a former prosecutor, that is a verdict that has gone through every level of appeal, and now I must do what I can as a member of Congress to make it work for my constituents. And I'm mindful of that, and I'm going to do everything I can to make it work for you. And if there are issues, I hope you'll let me know about it. I've learned about a number of different issues, and I'm committed to trying to mend any of those issues. But I have voted solidly against, and I will always vote against any effort that is just to repeal it and not offer any alternative. I think this is the way to provide affordable, quality health care. In the history of government programs, we've never had a perfect government program, but we owe it to ourselves to make this as good of a government program as possible. And I will always take the call from a constituent who wants help to make this work for them. So if we can go to the next slide, the Affordable Care Act, as I mentioned, it expands care, increases quality, and makes it more affordable. We can also go to, if you can go to the next slide, what we are seeing already is that millions of young adults up to the age of 26 can now stay on their parents' coverage because of the Affordable Care Act. That was not the case before. Next slide. It also has lowered the cost of care for those on Medicare and helps seniors save money on their medication. That is something that is not in dispute. It also requires insurance companies to provide preventive services like mammograms free of charge, and for men, free prostate screenings. Next slide. There's also an 80-20 rule, which is that 80% of the profits that the companies make must go to healthcare delivery services, and only 20% can go to administrative costs. And if that is not the case, Americans will receive rebates, and millions of dollars of rebates have already been sent to Americans. It strengthens and protects Medicare by increasing fraud enforcement capabilities, and we're already seeing insurers and doctors having to follow stringent rules on that. It also it ends lifetime caps. It ends insurance companies' power to cap the amount of care a person can receive in their lifetime. And now I'm going to let our experts up here, I'll talk about the 30,000-foot perspective of the Affordable Care Act. Our experts will dive into the details. But as far as the Bay Area goes, we've already seen the benefits. We keep talking about the Affordable Care Act's coming. It's actually already arrived, and in the Bay Area, 2 million Bay Area individuals, including 433,000 kids, now have health insurance coverage with no additional expense. Also, 1 million Bay Area seniors are now eligible for Medicare preventive services. Those are the mammograms and the prostate screenings I talked about. 75,000 young adults now have health insurance through their parents' plan. That's just here in the 12 counties of the Bay Area. And 63,000 Bay Area seniors received discounts worth $80 million. Finally, 369,000 children in the Bay Area were not denied coverage because of a pre-existing condition. And 2.6 million individuals have insurance that cannot place lifetime limits on their coverage. So that's just for the Bay Area. We're already seeing the benefits. We also know that there are tax rebates for small businesses, and we're happy to talk to you if your small business qualifies for that. And we're looking at putting together a program in the future. And 365,000 small businesses have already benefited from a tax credit across the United States. So again, I encourage you, help us make this work for you. Tell us what we can do to serve you. There's a number of agencies here and organizations that can make it best for you, whether it's through your own employer or through Covered California, the California Exchange. But what's encouraging to me, I was just reading in the New York Times today that they are showing that in New York and California, the premiums are going to be the lowest in the country for young people. And this really only works if we can get young people who are largely the uninsured in our country to sign up for the Affordable Care Act. Because where we were before this happened was we had a system of roughly 40 million people uninsured, many of them young adults who would not get insured, would go to the hospital when they needed care, where it's about 8 times more expensive to get care at the hospital rather than at a lower acute care facility. And that would drive up the cost of health insurance for all of us. So now, when you're looking at health insurance premiums being very low, in some states we've seen as low as $40 for a 27-year-old, and that's a study that we just saw from the Kaiser Foundation, a month, $40 a month for a 27-year-old with no limit on pre-existing conditions, that should encourage them to come into the system. And when you have all of those Americans coming into the system, that's what helps keep the premiums low. That's what helps allow the system to allow Americans with pre-existing conditions to not be denied coverage. So it's on the government now to talk about the benefits, get people to sign up, and serve you, the people who need it most. And so we're going to have our other panelists present here. Then we'll take some questions from the audience. But again, let me know how our office can best serve you, because that's why we're here. That's why we're all up here today on a Saturday, is to serve you and to make this work for you. Thank you.
I assume this is on. Good afternoon, everyone. Thank you all for being here on such a beautiful day. I'm going to make a comment in a second about the congressman, but first I want to thank Bishop Macklin. This is a beautiful church. How many of you are congregants? I'm sorry? Who attends this church? Okay, all right. Let's give the bishop and our church members a round of applause. It's a beautiful church. I started my day actually over in Lafayette. A very close friend of mine, his son was being bar mitzvahed this morning. So I really appreciate the sign and the solidarity with Israel and the state of Israel. And now coming to this beautiful church, I'm heading back over for a taco party for the bar mitzvah. So it's an all-day revival for me. So let's all have a good time, shall we? Okay. As I start, let me say a couple of things. One is that you may notice I don't have that much hair. I used to have a bunch of hair. But I was a student in Washington, D.C., something I share with the congressman in terms of having been an intern on the Hill. And I'll tell you, for those of you that are over a certain age, you may have an AARP card like I got last year. So I've been around for a while. But I'll tell you what, I have watched a lot of members of Congress. I've had the privilege to be with a lot of members of Congress since I was a teenager in Pennsylvania. I have never seen a congressman in 8 months get on, if you will, front and center and be as recognized and as forward-thinking and as bright, intelligent, and articulate, and he's already made this district very proud. So let's give him a round of applause. And to my friends, Dave and Alex, who I've known for a long time, we couldn't have a better partner in local government and our community health centers, so thank you. So what I've been asked to do in about a half hour, sometimes I say it's unenviable, but actually I love my job and I love being able to have a chance to talk with you. If we can go to the first slide, that's great. So what I'm going to try and do in about 30 minutes, and they're going to give me a 20 minutes on it, is really be the person to give you a very broad but somewhat specific overview of the Affordable Care Act, Obamacare, something that passed into law 3.5 years ago. A lot of people are just sort of focusing now as we get close to October 1. But let me ask you a question, or a couple of questions, and then let's start. But for anyone that wants a copy of my presentation, I will make sure you have it. And on the end, you'll have my cell phone and my email, so don't worry if you aren't scribbling notes. You'll have a way to reach me in my office. I had the privilege 3.5 years ago of being appointed by President Obama to my position, and I serve as senior advisor to Kathleen Sebelius, who is our U.S. Secretary of Health and Human Services. So let me ask you a couple of questions, and you can stand, you can raise your hand, whatever it is that makes you most comfortable. But some of you may fall into different categories and may be up and down, so at your peril, okay? How many of you are consumers? Okay? How many of you are small business owners? Okay? How many of you work for nonprofit agencies? Okay. Anyone here from our labor movement? Okay. How many of you are physicians, hospitals, other providers, community health centers? Okay. How about academics? How many of you are college students, or how many of you are just students in particular? Any agents and brokers that are out there? Okay. Social workers? How many of you are seniors and retirees? How many of you want to retire and aren't retiring yet? Okay. Okay. All right. Okay. Go to the next slide. Okay. The reason that I asked all of you that is because we're 24 days from history. 24 days from history. We are 24 days away from October 1st, where millions of Americans, 5.5 million Californians, many for the very first time, will be able to enroll in comprehensive, affordable health care coverage. 24 days away from history. Better care, better insurance, and staying healthy. If we go to the next slide. If we go to the next slide. Oh, thank you. Something I think the congressman already pointed out, so I won't go into all of the figures. But you know, Congress sets the framework. Congress makes the law. But it wasn't Congress that just sort of decided, and the president who appointed me, we need health care reform. This is a broken health care system. It's a system where we could deny people who have pre-existing conditions like cancer and heart disease and HIV health insurance. I've been a person living with HIV actually next week, 22 years that I know. And so I am extraordinarily passionate about passing on all of us, whether it's ourselves, our families, our friends, our communities, have people affected by conditions. And in 24 days, you will begin to have an opportunity, many of you, to sign up for comprehensive health care coverage where you cannot be denied health insurance because of a pre-existing condition, and your policy cannot be charged. You cannot be charged more because you have that pre-existing condition. But the reason that we have the Affordable Care Act isn't just because Congress voted. It's because millions of people across this country said, enough is enough. Healthcare is a right, it's not a privilege, and we need to do everything we can to make that change. So when we talk about a federal law, which I'm about to talk about and dig down, it's local implementation. In my region, it's local, tribal, and territorial implementation, because I represent California, Arizona, Nevada, Hawaii, our 3 territories in the Pacific and 3 countries. We have 50 million people in our region. And my sense is this community mirrors what we see throughout our region. So the very important part of that. So the next slide. So we're going to talk mostly today about the opportunity you're going to have over the next 6 months, and hopefully within the next 10 weeks, starting October 1, to enroll into comprehensive health care coverage. But we also didn't just flip on a switch. The law was passed and the president signed it into law March of 2010. And so when you see consumer protections and you see improving quality and containing costs, what we've done the last 3.5 years together is knock down some of the worst aspects of our health insurance system. And I'll show you that in a moment. So we've expanded consumer protections to help people who have coverage to start to contain costs and to increase the quality of our health care. And I'll show you in a minute what I mean by that. But I want you to sort of take away one thing. 85% of our United States has health insurance. What we're about to go through really doesn't affect most of them. If you like the health care you have, you can keep it. A lot of people get health care through their jobs. But of those 15%, what we're talking about today is about people who buy coverage on their own. So if you buy your own insurance, or you buy your own insurance for you and your family, or you have a small business. Small business is defined as under 50 full-time employees, full-time equivalents, so 30 hours a week, under 50. And we'll talk a little bit about that. So we're talking about those 15%. So if we go to the next slide, the congressman mentioned briefly, these are some of the things that have gone on in the cost containment system, but I want to get to the meat of what we're doing. Let me just say this. Healthcare costs are growing the slowest they have grown in 50 years already. That is not just because of the improving economy. It has a lot to do with what we've done through the Affordable Care Act, and I mean communities together have done together. So I won't go through all of those figures, I'll show you, but the congressman actually mentioned the 80-20 rule. That means today it's been like 60 to 70 cents on every dollar spent by a health insurer has been on benefit, your health care. But 30 to 40 cents has been on administration and profit. So now when you think about tax day on April 15th, think about rebate day, August 1. Because if your insurer doesn't spend 80 cents on every dollar on your health care, by August 1 every year, you get that money back. And $1.6 billion has gone back to the American people. And it went down this year. It's good it went down, because it means that they are spending the money on the benefit that they have. If we go to the next slide, the congressman did a great job at saying to you, okay, here are some of the things in the Bay Area. Here are some of these consumer protections, like young adults between 19 and 25 being able to stay on their parents' plan. Seniors and people with disabilities having free preventive care, right? As well as people in our just sort of general communities having that. So there's no more cost. There's no out-of-pocket costs when you go to get a mammogram, or you go to get a cancer screening, or you go to get nutritional counseling for a senior, contraception, and domestic violence screening and counseling. Very, very important preventive health measures that are on there. So 8 million privately insured people. These are all California. And there's no longer any lifetime limits on your coverage, and starting in January, there's no annual limits. But what I mean by that is, it's not that you get everything, you know. What it means is you can never run out of your health care benefit. If you're a person living with a chronic condition and you have cancer, in 2 or 3 months, you could cap out in the past. And therefore, what does it do? It renders you uninsured. Well, not any longer. There cannot be any way that you can be made uninsured or turned down, or because you have a pre-existing condition, pay more for that coverage. 50% of the people in California, 50% of the people nationally that declare individual bankruptcy, do you know why? Unpaid medical bills, 50. This is what we've already done with Obamacare. So let's go now, and let me give you what we're going to talk about today. And I'm going to do the national sort of California level, and Alex is going to do Alameda County, and we're going to have Dave talk about our great community health centers and his in particular. So here's where it goes. Starting October 1, millions of Californians will have the opportunity to enroll, many for the first time, in coverage. It is a 6-month open enrollment. It actually goes from October 1 to March 31st, 2014. But if you enroll by December 15th, think about it, right during the holiday season, you will have coverage effective on January 1st. And again, we're talking about people who have coverage on their own, people who buy it for them and their families, or small businesses less than that. In the congressman's district, there's 80,000 people who are uninsured. There's another 37,000 people who have individual policies or in that small business. They can actually shop to get a better deal. So what this law says is, beginning January, most Americans and U.S. citizens and documented individuals must have health insurance. That's the requirement. But the flip side is that you can't be turned down, and remember, you can't be charged more because you have, or even if you've had a pre-existing condition. If you have a child or grandchild that had asthma and grew out of pediatric asthma, before this law passed, they still could be turned down for health insurance. No more. So if you go to the next one, how many of you, I said, are small businesses, whether you're nonprofits or for-profits? How many of your small businesses under 50? Okay? How many of you are nonprofits? Got others? Okay. This is one of the biggest, shall I say, pieces of misinformation that come out about this law. I have worked with many, many, many small employers who say, you're going to require me to have health insurance, and it's going to bankrupt me. I cannot afford that, or I can only pay a little towards it. I'm going to be fined. And these are small businesses that have 5, 6, 7 folks. That is absolutely not the truth. Out of 100%, what percentage of our country do you think are small businesses under these 50 full-time equivalents? Anyone want to guess? I'm sorry? 75? 95? 60? I feel like an auctioneer. Anyone? Okay. 96%. So 96% of our small businesses, for-profit, tax-exempt, are under 50. If they do not offer health insurance, there is absolutely no penalty. Their workers can go to this new marketplace, which we're going to begin to talk about now. So 96% of businesses are small, and they are exempt from any requirement. They are not required to provide health insurance. Many of them do, many of them want to, and that's the small business tax credits that the congressman talked about, and I'll share that with you in a moment. So if we go to the next one, what I want to sort of talk with you about is, we already have now said, look, this law has passed 3.5 years ago. We have made great strides in providing consumer protections to those who are insured. We've done a significant amount, but a beginning amount, to reduce costs and increase the quality of health care. But now, come October 1, millions of Americans are going to be eligible to come into coverage, and that includes individuals and small businesses that are going to come into coverage. So now we're going to say, okay, how is this coverage being expanded? What am I eligible for? What does Obamacare really mean to me, to my family, to my community? There are 2 ways under Obamacare that insurance coverage is going to be expanded to the American people. And the first one is, many of you are probably familiar with our Medi-Cal program, Medicaid nationally. Well, Medi-Cal and Medicaid has largely been a program for poor women, pregnant women, and children. Okay. It's not been a man's program. And it really is a program for those who are disabled. But in this country, a little known fact sometimes is, for those making under 100% of the federal poverty level, some of the lowest income of our brothers and sisters in the community, not automatically eligible for Medicaid. So the first part of Obamacare is if you make $16,000 a year or less, $16,000 a year or less, regardless of disability. Childless adults are a huge category in there. Men are a huge category that are in there. But also families making under $33,000 a year. You're eligible for Obamacare through an expansion of the Medicaid or Medi-Cal program, and that is at no cost or low cost. So $16,000 a year and under, $33,000 for a family of 4. If you go to the next slide, and you can go to the next slide. Okay. So let's go to the other side of this. So we've got individuals and we've got small employers. And individuals today and small employers under 50 are the ones who, when somebody gets sick, they can say, not going to insure you. Or, sure, we'll insure you, but we're going to charge you $1,500 a month. Well, a lot of people have gone bankrupt trying to do that. A lot of people have stayed out of health insurance. They've gone to hospital emergency rooms. They've gone to our community health centers, which the law actually provides $11 billion to grow our community health center system. So we know that there's been many obstacles for individuals and for small employers. Profit, tax exempt when I talk about small employers. So if we go to the next slide. This is the other thing. In a minute, I'm going to show you a video for 93 seconds. So 2 ways to expand health insurance. One, we talked about, Medi-Cal. you make under $16,000 a year, or a family of four under $30,000. How many of you have heard the word exchange? Marketplace? Covered California? Okay. They all mean the exact same thing. And so what Obamacare provides is a new way for you to shop for health insurance. This is for working families. This is an opportunity, whether you sign up online, whether you sign up through a community-based organization, a small business association, or whether you go to an outreach and education fair and there's entities that help you enroll. This new marketplace is a subsidized marketplace. It's a place for you to get comprehensive coverage at an affordable price and, depending on your income, help in paying for those premiums. So we've already talked about you have Medi-Cal, and that's low or no cost. But now the flip side is that on October 1, there will be 50 marketplaces, 50 exchanges, 50 entities opening up for enrollment across this country. And in California, if you go to the next slide, California is called Covered California. Can we show the video quickly? And then I'll come back and do the last piece of this and show you what the benefits are.
You can do all the things you do with more peace of mind, less worry, and more financial security when you know you've got health insurance. And now everyone will be able to find health insurance at the Health Insurance Marketplace. It's an online shopping site where you shop for health insurance that fits you with low cost and even zero premium plans for those whose income qualifies. If you or your family are uninsured or just looking for better coverage, you can see your options all in one place with one application. It's a place to compare a wide range of quality health insurance plans, to review them all side by side, and choose the one that's right for you. You'll find the information clear and easy to understand. You'll explore the marketplace at your own pace. You can compare prices and benefits, see an explanation of what a premium is and what a plan will cost you every month before you make a choice. And every plan will cover you with comprehensive benefits, from your visits to the doctor or the hospital, to your prescriptions, to screenings for cancer and other conditions. And no plan can turn you away even if you already have an illness or condition. The Health Insurance Marketplace, part of the healthcare law, opening October 1st. You can learn more right here, right now, and be ready for the new world of health insurance shopping.
She's so adorable. The coverage begins January 1, 2014, and as I said, open enrollment October 1st to March 31st, 2014. Go to the next slide. Okay? Go to the next slide because you've just seen some of that. So one thing I want to do as we move into this last section around the benefits is that for 2014 and 15, this is for those small businesses, profit or tax exempt, who are 50 full-time equivalents and under. But in 2016, those small employers that are under 100 can also buy their health care coverage through this marketplace. And then in 2017, the state legislature and you could decide to open it up to larger employers. So it's a good thing to know about Covered California in the marketplace because it may not affect you, it may affect your neighbor or someone that you go to church with, but it could in the future. And so if we go to the next, okay, so we talked about the cost sharing and premium discounts. We go next, okay, the healthcare tax credits. Now, I always point out when I say tax credits, it applies to for-profit or tax-exempt. They have credits. But this law, this part of the law passed and was signed, when the president signed the bill, went into effect immediately. So what does this mean? This means for any small business under 25 who pays moderate wages, okay, they may be eligible. 2010, 11, 12, 13, going into now 14 and 15. So if you think you may have been or worked for a small business that was providing health coverage and could have gotten that credit, the IRS actually lets you go back and claim that credit. And it's 25 cents off $1 today of premium for the nonprofits, the tax exempts, and 35, but it goes up to 35 cents and 50 cents on the dollar next year. To get the premium assistance as an individual, or those individuals with families, or to get the credit that this has, you must get your health care coverage through the marketplace. But let all your small businesses that you frequent every day, remember, about 99% of all of our businesses in California are small businesses, that they should be aware of these. And the owners and their relatives do not count in the calculation of whether they are eligible for the credit or not. It is solely the wages that they are paying their workers. So if you go into the next, so you've got competition, affordability, quality, and clear, because you'll have, whether it's on the website or you'll have written information walking it through with community organizations. This is what it's all about. Remember I said local implementation? This is not about the federal government and saying here and come and here's your book. It is your neighbors who are signing on to become application enrollment assisters, who are going to be the ones that you're going to see, whether you're going to see them in your day-to-day community, in a federal government agency like the SBA where you can come in and get that information, signing up for WIC, signing up for TANF, Head Start. There will be information everywhere to be able to help direct people to these outreach grantees, to the Covered California website, if you want to sign up online. If you go to the next. So this is sort of the ending piece of this. So we've talked about there's a requirement that starting January 1, most US citizens and documented individuals must get health insurance. Flip side is, can't be denied because you've had or have that pre-existing condition, cannot be charged for it. Okay? I'm talking about women of pregnancy age that were denied health care because pregnancy was considered a disability. Okay? No more. Children under 19 already against the law to say you can't have health insurance. So October 1 to March 31st sign up. December 15th, if you sign up by December 15th, your coverage begins January 1, 2014. We've talked about people who are individuals making less than $16,000 a year will now qualify for a comprehensive Medi-Cal plan. Families of four under $33,000. But if you're also between $16,000 and $45,000 as an individual, or $33,000 to $92,000, you are eligible for this premium assistance through this new marketplace called Covered California. As an individual who buys coverage for themselves or for the small businesses under these 50 full-time equivalents. And this is the benefits. This isn't all the services. On October 1 on Covered California's website and throughout all of this network of nonprofits and faith-based organizations and provider associations, small business groups, you will get to see what opportunities you have in Alameda County for coverage. But if you look at these benefits, these are the things that America stood up and said, why don't we have these? And this, regardless of whether you're an individual or a small business buying your coverage through this new marketplace, or you buy it in the private market, or you buy it on Medi-Cal, you have maternity and newborn care, mental health and behavioral health, substance use disorder parity. That means mental health and substance use parity with medical and surgical benefits. Habilitative and rehabilitative care. What does that mean? We all talk about rehab and the rehab facilities that we have, the great ones. But what about there's someone who's having problems, say, with their hand, and maybe it's carpal tunnel and it's causing a problem. Why do we wait until you can't use it to rehabilitate it? Well, now there's a benefit that makes sure that you're covered to help you keep that functionality. And prevention, wellness, and chronic disease management. Making sure that you have a visit annually to your healthcare provider to talk about whatever you want to talk about in managing your own health. And so October 1, you will see your choices through Covered California of not only these benefits, but what services do you have? What are those co-payments and deductibles? But remember one thing, there are out-of-pocket limits. This will be 24 days from history. Every American getting their coverage through Obamacare for the first time in history will have out-of-pocket limits on their medical costs because of Obamacare. So if we go to the next, there are 4 levels of coverage in California. They are standardized. What does that mean? Just means that the benefits are all the same. It just is how much do you want to pay in co-payments out of your pocket and the premium side. So bronze, silver, gold, platinum, you can pay 40% while the plan and your employer pays 60%, or the Covered California up to 90-10. And we can talk about that in the Q&A. Go to the next one. Key parts to remember. October 1, we're talking about working families. We're talking about a one-stop shop that starting on October 1, you can call them on the phone, you can meet with organizations in the community, you can talk with my office. There are many, many, many ways. And for your friends and families across this broad country, let everybody know that there will be 50 marketplaces operating starting October 1, whether the state-based marketplace like Covered California is here that you have the benefit of, or in my region in Arizona where we're facilitating, working with the community, the federal government is running sort of the operational piece of that. But the Covered California plans are modeled after plans that have been offered here in California. So the last slide, take down my cell, take down my email, and healthcare.gov and cuidadodesalud.gov are the 2 front-facing websites that the department has, in addition to coveredca.com, which is the Covered California website. Coveredca.com. You can get there through healthcare.gov. You can get there through cuidadodesalud.gov as well. So I'm over my time. Thank you, and I look forward to the Q&A.
Thank you very much, Herb. I have received a number of overviews of the Affordable Care Act, and that is as thorough and informative as I've ever seen. And for you to do it on Saturday when you have other plans, I think it just shows your dedication, and you have a personal story to tell as well. But I really appreciate you coming out here and doing this. So one more round of applause for Herb. For your own health and well-being, feel free to stand up, stretch out. We're going to have now Alex Briscoe talk about what the Affordable Care Act means more for Alameda County and the effects it's going to have and what it's going to do to help you here.
Okay, thanks. My background is in mental health, and one of my clinical supervisors once said to me that human beings have the most complicated descriptions for the things we understand the least. And healthcare and the competing processes and business stuff that goes on with our healthcare system, this is a great example. You may be looking at one of the only 2 people you know who've read all 1,240 pages of the Affordable Care Act. And it's my job in the next 10 minutes to distill it for you so you can understand it. And Herb did a great job, but I'm going to do so from a little bit more of a critical lens, because I hope we all accept the irony that after 30 years of challenges with the health insurance industry, we just passed a law that said you got to buy it. right? And despite that it's my profession and my life, I know that none of us loves to interact with our health insurer. Like, we don't all run and go home and say, oh, great, I want to talk to Blue Cross tonight, right? So as a culture, we've made it shameful to be tired, sick, and hurt. So we have to reinvent our healthcare system, and health insurance is not healthcare. Health insurance is how we pay for healthcare. And so I'm going to start my presentation with some uncomfortable data from Alameda County. Next slide, please. First, we are the most diverse county in the nation. And I fight with the people from Manhattan about this. But if you measure ethnic plurality, basically the zip codes where an ethnic minority is the majority of the population, Alameda County has the most zip codes where an ethnic minority represents the majority. So this is a unique benefit to Alameda County. But it means that we have to have a certain type of provider system which speaks the language of the people who get served and is accessible to those folks too. Next slide. And unfortunately, we can tell you how long you live by what zip code you live in. This map shows you up here morbidity by zip code. The darker the color is, the shorter you live. This is meant to make you uncomfortable. And if you go to the next slide, this is from birth and death records that we collect as the Public Health Department. And the reason I'm showing you this before I get back into the health insurance and delivery system issues is we can't treat away the things that are actually making us sick. In 1960, African Americans lived about 4 years less than their white counterparts in Alameda County. By 2009, that had grown to 6.5 years or 6.4 years. Today, it's almost 7.5 years. So despite the gains of the civil rights era, African Americans are living almost twice as fewer lives. The morbidity gap has almost doubled, despite the legal protections of the Affordable Care of the civil rights era. My point that I'm making here is, if you took the $800 million that my agency spends and put a dollar on the map for every dollar we spend, the places we spend the most money is where healthcare disparities have persisted the longest. We're not going to treat away the things that are making us sick. So I'm sorry to be such a wet blanket. I'm going to get back to what an extraordinary opportunity we have in front of us. But the things that are making us sick are poverty, poor schools, unsafe communities, not clean enough air to breathe. And the Affordable Care Act, despite the fact that I welcome it, and I'm a huge supporter of it, and I'm so grateful for President Obama's leadership, it is not the answer to the things that plague us. 1 in 4 Oakland children are born poor. Poverty is more stable now than it's ever been in the history of America. So when I dig into some of this stuff around health insurance, hold a critical lens. We're all smart folks. We know that a doctor doesn't help you get a good job. We know that a health plan doesn't necessarily make for a safe community. There's other parts of this work that is actually essential if we're going to change health outcomes. Next slide. This is, and you can just click through this slide quickly until the next slide comes up. This just breaks this data down that I just gave you on morbidity. African Americans are 1.5 more times more likely to be born premature. By the time you're a child, they're 4 times less likely to read a grade level. And by the time you're an adult, 5 times more likely to be hospitalized. This leads to a 15-year difference in life expectancy. The next slide shows what's happened in the most recently in the number of the uninsured in Alameda County. So between 2008 and 2010, not a lot of good stuff happened to the working poor, right? The number of uninsured grew from 166,000 to over 200,000. And today we have about 220,000 uninsured Alameda County residents. And as Herb showed, and I'm going to show you in a second actually what's happening here, there's this Medi-Cal expansion that's going to cover a lot of people, and people like me who work in the safety net, we welcome it. But the Affordable Care Act is not a welfare program. It's clearly targeted at the working poor. In fact, twice as many working poor get help under the Affordable Care Act as those who get free health coverage under Medi-Cal. Next slide. And as I said, where you live matters. The commercial and private insurance industry work great in Piedmont. It doesn't work so great in West Oakland and parts of Hayward. And as you'll see here, Hayward is actually second to Oakland as a major city in terms of the rate of the uninsured, over 17%. Next slide. Currently, of these 200 or some thousand uninsured, the vast majority are those 19 to 64-year-olds. So how many people were born after 1965? Okay, great. For those of us here who were born after 1965, the Affordable Care Act is the most sweeping legislation, federal legislation in our lifetime. But to quickly distill Health Policy 101, 1965, as Herb said, Title 19, Medi-Cal, Medicaid, and Medicare are created. Medicare for everyone over 65, Medicaid for poor folks, right? You know it as Medi-Cal in California. But to get Medi-Cal, you had to be a child, or a poor woman with a dependent child, or disabled, leaving us the only industrialized nation in the world who offered no medical safety net for those people 19 to 64, what we call the medically indigent adults. Right? And it's complicit with poverty. Like, you have to understand that poverty connection. Right? We have this law called EMTALA, and all receiving centers that our ambulances take you, we can't turn you away. We got to treat you, but we can charge you whatever we want. So 1 in 4 bankruptcies in Alameda County, and I heard Herb say 50% of all bankruptcies nationwide, are driven by medical debt. So frankly, the health system we have that is more defined by shameless profiteering than it is on any getting access to basic human right has to be adjusted. And the Affordable Care Act does some important things, but unless we are vigilant, the Affordable Care Act will be the single largest act of corporate welfare in the history of America. Within 2 years, more public dollars will land in private interests, more than the TARP. So we have to be careful. And again, I welcome, and this is not to critique any political leader, this is, for me as a health director, this is the most important thing that's ever happened. But it isn't perfect. It's a compromise. And we have to really watch it and drive it to make sure it works. Next slide. Well, before I leave this slide, if you go back one time. You see the children up there? There's 21,000 uninsured children. The reason I like to point that out is that we've done expanded coverage for children already. Remember SCHIP, what we used to know as Healthy Families? Well, of those 21,000 children, 14,000 are eligible but not enrolled. So how many people have filled out a Medi-Cal application? Okay, you should try it one day. It's humiliating. It's 48 pages long. It's really difficult. And so, as Congressman Swalwell really importantly pointed out, the way health coverage works is you get everyone under the umbrella, and you collect money on the healthy people to pay for the people who are using the system, right? That's what per member per month, that's what capitation means. Well, if you keep the healthy people out because the application is too hard, you end up only serving sick people, you don't have enough money, the system collapses. So we have to reform eligibility enrollment to make it easier to get in. The way we used to ration care was to make it hard to get in, but that's not how coverage works. So massive changes have to happen, and some of them are. Removal of the acid test, the simplification of the application, but we still have a lot of work to do to make it easier to get in. Next slide. I'm going to skip, if you could click through the bullet points on this slide till the next slide, because Herb covered all these very well. But as I mentioned, a complicated bill and ramp up, I'm going to just stop here for a second. There's the heart of this thing is this coverage expansion, right? We're giving people new coverage. That's the individual mandate, right? You got to have it. The same way if you drive a car, you got to have car insurance, but 22% of American drivers drive uninsured, right? So just because you got to doesn't mean you have to, you get it, right? Medi-Cal, this really important expansion, the exchange and employer stuff that Herb went through, there's really critical insurance market reforms, and you heard many of them, and I welcome them all. They're really important. Caps, all the caps that Herb went through, I won't go through them again. But I would argue that there's a reason that every private industry insurance trade group backed the bill, and every major pharma interest backed the bill. Because these were relatively small gives for a law that you had to buy my product. So we have to stay vigilant, and the 80-20 rule is a great start. But we have to make sure our public sector enforces it effectively. And then under funding for the safety net, you're actually in the most progressive county in the nation in terms of early adoption of the Affordable Care Act. As Herb mentioned, March 2010, the bill was signed. But the expansion doesn't begin until January, right? But the bill said, if you're a county and you want to, you can expand now and get 50 cents on the dollar for the money you're already spending. So you know this in Alameda County is a program called Health PAC. And I can say, I'm very proud to say, that UCLA just put out a report 2 weeks ago. 96% of the Medicaid eligible population who get eligible in January 1 are pre-enrolled and will convert automatically. That's 46,000 of the 56,000 or so who will be eligible will convert automatically. That's the highest percentage in the state by far. The next county is in the 60s. I see some of our colleagues in the back applauding. Thank you, David and his team. It's really an extraordinary accomplishment. And the average across the state is 15 to 20% of the eligible population is pre-enrolled. Next slide. So of the, if you could click through to the next slide, of the 1.5 million people, in 2006, and we say now in 2012, 230,000 folks were uninsured. If you assume for a second, so forget what I just said, all that dark stuff, right? And pretend everyone got what they should. Just pretend for a second. Okay. 56,000 Alameda County residents will get free health insurance through Medi-Cal. 56,000. It'd bring in about $230 million of new federal money. And the reason I say that is, remember one of those things I said, that more important than the best doctor is a good job? If we're not careful and make sure that some of that $230 million land in the hands of employment opportunities for Alameda County residents, it's not going to help. Well, not as help as much. 107,000 folks get it through the exchange. And you could click just quickly through to the next slide where I show this graphically. And so this graphic shows when Herb was going like this is what he meant. From 0 to 138% of federal poverty, 56,000 people get it. And then from 138 to 400, another 107,000 get it. So that's what it will mean, right? Now, of those 56,000, about 50,000 we've got pre-enrolled. Again, highest in the nation. We brought in $50 million a year of new revenue. So we're having a running head start at the Medi-Cal expansion. Of those 107,000, we're deeply concerned with the cost of the premium. But as Congressman Swalwell just said, we're going to have some of the lowest premiums in the nation, so we're still hopeful. There's some concern that the cost of the premium is going to be so high that some will be exempted from the mandate. So it's really important to try to suppress the cost of the premium. Because again, as much as us health policy people say, yay, health insurance, right? If you're making $16,000 or $17,000 a year, anything out of pocket, anything, is a stretch. So 70, 80, even 90 bucks a month is money that people making $18,000, $19,000 a year don't have. So we have to be really careful and help build a culture of coverage, which says, if I'm alive and I got a family, I know I got to have it. And it's a product that's worth purchasing. Next slide. I mentioned our LIP enrollment. We have 90,000 enrollees, 45,000. Next slide. And this map shows you where we still have people who are unenrolled. And the point of what I'm trying to say is that in poor communities, particularly communities of color, the sense of health insurance is a new thing. We got to teach folks that it's something you got to have. And we know where people are who don't have health insurance. And if you took this map and overlaid it with the 911 calls that we run, and then overlaid it with the hospitals that go on diversion because they're busiest, and then overlaid it with those communities that use the emergency department for the lowest acuity reasons, same neighborhoods. We have a dramatic supply and demand disconnect at primary and preventative care. We don't have enough primary care. It's not open at the right time. When I talk to my friends, I say, I know we'll have a reformed healthcare system when primary care opens at 3 p.m. and closes at 10. Because that's when the hospitals go on diversion. That's when the working poor get off shift work. And that's when 9 to 5 folks can afford to leave work and get the care they need. We've designed a healthcare system for the people who work in it, not for the people who need care in it. And there's really important things that have to change to delivery. And David will talk about some of them, and Tiburcio is a great partner in that work. Next slide. So as I mentioned, eligibility does not mean enrollment. We have to fix how people get in. Enrollment doesn't mean access, because we wag our finger at poor people now and say, hey, stop going to the emergency room. But where are you supposed to go again? There's no primary care. My wife is a primary care physician, one of 5 doctors in a class of 140 that went into primary care. She's making less than the nurse practitioner she supervised her last year of residency. It's a dramatic problem. We're not paying enough, we're not training enough, and we have a system where costs are rising at 4 times the rate of wages, though, since the Affordable Care Act, that rate has significantly declined. Next slide, and you can skip through these next 2 slides because Herb covered them all very well. So we know that in our existing safety net, that means Medi-Cal and the uninsured, it can take up to 3 months to get a new primary care appointment and up to 6 months to get a new specialty care appointment. Next slide. These are our 14 911 receiving centers. We've worked with all of them to create urgent care opportunities. Kaiser had it right, and Kaiser's a great partner in Alameda County. 60% of the commercial marketplace is here. Kaiser was born here. It's a great product, a great partner. And Kaiser has done a study with us that showed half of all emergency room utilization could have been seen in primary care if it was open or available. So half the people who go into the emergency room could have been seen in primary care. So we created urgent care. Now to contract with us as a 911 receiving center, you have to offer urgent care. Took the cost per unit from about $900 down to about $400. But the cost per unit should be about $150 or $200 like it is in primary care. So we still have work to do. Next slide. This is a map of all of our existing safety net providers, over 40 primary care sites, our 14 urgent care centers located in hospitals. We're very proud of this progressive system. I work for Supervisor Richard Valle, and I only could work in a couple counties because Alameda County is one of 3 counties left in the state of California that sees health care as a basic human right and does not discriminate on immigration status for access to it. We serve everyone in Alameda County, regardless of their immigration status. We have 45,000 enrollees in our program who will not qualify for anything under the Affordable Care Act because they can't prove their citizenship. And we can argue all day long the politics of whether they should or shouldn't be in, and as a nation of immigrants, whether that's fair or not. Pragmatically, if I don't offer primary care to folks, they cost me more, a lot more. So just as a taxpayer, from a business perspective, it makes sense for us to serve folks who are here. And the politics aside, from a social justice perspective and an economic perspective, it's just common sense and practical to do what we do. I'll end with some hopefulness, because delivery system reform actually can happen, and it has happened in Alameda County, and I'm going to cite an example as I close. Next slide. And I'm going to move quickly through the next 5 slides, so see if you can time it with me. In 1996, we went into 4 schools in Alameda County that had a high concentration of poverty. And we started these clinics in schools saying, you know, this sounds like a good idea. A lot of kids, they have a lot of needs. We took this lemon of increasing concentration of poverty in public education and said, well, at least we can bill Medicaid. So let's go with me to the next one. In 2000, we had 8. Next. In 2004, we had 12. Next. In 2008, we had 14. Next. In 2010, we had 19. Next. In 2012, we had 26. Next. And hold for a second. And we have 2 more coming. We'll have 28 at the end of this year. All are federally qualified. In fact, our goal is to make Oakland Unified School District the first school district in the nation to guarantee universal access to primary care as a function of school enrollment. Every middle school and every high school with more than 200 students has a comprehensive primary care clinic. Lab, pharmacy, it's as nice as where you get your care, right? And we figured out a way to pay for it. It's entrepreneurial. 80% of its operating, of all of the budgets of all 28 clinics, is funded through the services they offer. If kids come, the business plan works. So we're taking this opportunity and revenue and business approach to healthcare to meet a pressing human health and social service need. But this process taught us something too about bringing care where people are, right? The biggest loss leader in primary care is no-shows. Right? Like, I can't bill for a visit if you don't show up. Well, at a school, if Johnny's not there, Jimmy is. So you can really mitigate some of the things that hurt your business model if you run a school-based clinic effectively. And so what we did is looked at this model and said, what else would we do? So we tried to map our existing healthcare system. We go back to that one slide. This is your General Acute Care Hospital, stands for a hospital with a 911 receiving center. That map I showed you, 14 of them. Next. I'm sorry, hold. This is your existing healthcare system, right? As much primary care as we can purchase. If you want to run a primary care clinic, call me. We'll pay for it. If you got the docs. Urgent care. What I just talked about in and what we said is this system here is constrained. It's driving utilization to the highest cost setting, right? You're going into that center of the circle to get care. And so the school-based health centers taught us, one click please, that there's a level of care missing in our healthcare system, and not everyone loves it, but we sent staff for 6 years to Cuba to look at their low-cost system. And they came back with stories of these really low acuity clinics based in neighborhoods. And what we did, next click, is we looked at the experience of the 28 school-based health centers, next click, and we expanded to community colleges, opening new primary care clinics at Laney, a dental clinic at College of the Alameda, a mental health clinic at City College of Berkeley. Next. And then we proposed, as Congressman Swalwell said, and Hayward will have the first one, using the expertise of the 911 system. Firefighters, 85% of what they now do is respond to 911 calls. They become critical players in the EMS and pre-hospital care world, and they're trusted. And so we wanted to look at a way, when you ask poor communities, what buildings do you know of that are in the public sector, they'll say schools and fire stations. And so we wanted to use that trust and natural alliance that firefighters have and the geographic distribution of fire stations to generate new access points in communities that are underserved. And then finally, we opened up new access points in the Hayward Day Labor Center and also in 2 other day labor centers spread throughout the county. This is your new healthcare system, right? We believe that if you build these portals, you can divert people out from the higher cost settings and help bend the cost curve. Next. I think I'm done. Lastly, this is our version of where to get the same information that Herb talked about. If you go to achhealthcare.org, you can type in whatever you want. If you want a doctor, if you want a clinic, if you want a service, and then it'll give you, through GPS mapping, the closest available thing to the address you put in. It also has access to my presentation. Herb's presentation got loaded there last night too, and a bunch of other information and data. Thank you.
Thank you very much. Let's all stand for a moment, catch our breath. This is a lot of information real fast, and there will be a test right after this. Right where you're standing, why don't you do yourself a favor and stretch yourself, but also stretch your relationships by finding somebody you do not know, introduce yourself, make a new friend before you're seated again. Thank you. Thank you very much. Let's give a round of applause for all that we've heard so far. Great information. Thank you very much. Our congressman is coming back with a very special offer, one you can get for free today. All right? And then he'll introduce our next presenter. Thank you.
All right, we have one more presentation, then we're going to take questions. I do want to encourage everyone to go across the courtyard and get a free eye screening, free dental exam, or free glucose screening. They are out there. They are eager to serve. You'll get a free toothbrush, toothpaste kit if you go out there. So again, please, I know it's like pulling teeth, but go out there and get exams. So next, I'm going to turn it over to David Blake.
Thank you, Congressman Swallow. I appreciate it, and for the invitation as a provider of health care in the community. Good afternoon, neighbors, friends. My name is David Vliet, a little tricky last name, and I am the CEO for Tiburcio Vasquez Health Center. We have a proud tradition of being your neighbor and your healthcare provider for 45 years, and we will continue to do so. And as the speakers have talked about today, I want to add and localize this a little bit. I want to add some local perspective as a primary care physician and provider of health care in the community. Tiburcio Vasquez will be a resource for you, and I have some numbers for you. If at the end of all this you're confused, you can call our office, call me, and we'll try to help you sort through this. Now, I have an 83-year-old mom, and she not too long ago said, "Can you sort of summarize this for me in a few sentences?" I said no. But even if I did, she'd ask me 100 other questions, and they'd all be good questions. And I would respectfully answer all of those questions. And so two things stood out today in the conversation in terms of the information. You've been given a lot of broad stroke information. I know you're anxious to ask your questions, but I want to sort of just summarize a couple of things that I think they're important for us as active members of the Hayward community. Tiburcio Vasquez serves and has served in Hayward, Union City, and we're now opening a new center in San Leandro, but I'm your neighbor, and I would ask you, have you gone for your 30-minute walk today? Okay, so we need to get our 10,000 steps in, and your iPhone or your phone can help you keep track of those, but prevention is a major part of what a community health center does in terms of our work. Formed about 45 years ago, the legislative concept was through Ted Kennedy. Community health centers are all throughout the United States. You've got a number here in Alameda County. We are prepared and ready to work with you and your families. 1 in 15 Americans seek health care from a community health center. So whether it's a sister or a cousin or a neighbor or an auntie that is without coverage or needs to see a primary care doctor, we are here to serve those folks and families without regard to their ability to pay. Community health is a discipline of the public health field, and our goal is to elevate the outcomes of our community through preventive care and primary care. And we've been doing that successfully for 45 years. I know many of you have your favorite doctor, and you talk to him or her about your diabetes, and you got the hypertension going on or whatever it may be, and they sit with you and they talk with you about your health care, and that's what we do. We have a variety of other services that we provide, including family and social services. We have an extensive community health outreach program, which is part of what I'll talk just a moment about today, in terms of how we can help you in your understanding or with a loved one get involved or enrolled in services. But it's very important that that we're very clear that as prevention has been outlined in the Obamacare program, we intend to deliver that care, that prevention care. So when you come to see us, we will talk about those things that help improve, that indeed will improve your health. As a discipline of public health, community health is typically the doctor's office. We're here to help serve you. We also provide dental care, which is a very precious commodity, particularly for adults in America that have no dentist. Behavioral health. We work with clients and patients of all income levels and races and ethnicities. Sometimes you just need to talk to someone about where you are with your mental health, and your personal life. School-based health is something Alex touched on, and we do operate the Logan, Tennyson community health centers within the schools and work with a lot of teens. Some of these might be your grandkids. Some of them might be your children, but we work with young people because we really believe, again, prevention and primary care is a key to mitigating the costs that we're all dealing with as it relates to health care. Our board of directors, we have two members here today, Juan Gomez and Lupe de Anda. They have spent many years working hard for the preparation for the Obamacare implementation. And so to that end, we have expanded our capacity. We're just one of many providers that will be on the list in the exchange, but we have increased our capacity, and by next year we'll be at that's a 46% increase in our ability to take new patients. And I'll, again, give you some resources where if you need us, we're here for you. But the reason that we have a board that is made up of folks from the community and that are must be 51% of our board members must be recipients of care is they tell it like it is. They tell us what their experience with us is as a patient, and it keeps us in touch with what the community needs. Again, we're community-based, and as Alex mentioned, we are federally qualified, which gives us an additional benefit in terms of how we're paid for the service we provide. It gives us access to a very broad formulary, so patients that see us have access to medications they certainly couldn't afford if they were not seeing us, and a number of other benefits. So the federally qualified status has put us in the unique situation where the $11 billion investment that Herb referred to previously that is going into primary care, a lot of dollars are going in to strengthen this safety net, as, again, Alex referred to, and that's us. We're here. In many cases, we're the last stop for folks who've lost their jobs, their COBRA has run out. They just need to see a provider. We have funding from the federal government for outreach and enrollment, so we have an official responsibility to help folks enroll in care. We have some folks that have been certified to be covered California navigators to help people navigate through this marketplace and this exchange. And so I'd like to give you a phone number that you're welcome to call. You can also stop by our table out there and talk with some of the folks there. Carlos Londoño is our director of community health outreach. He's in the back. And we've been doing consistent community health outreach and education for many, many years, and we will continue to do that. So we're here to help answer those questions. But we also are now paid for 2 full-time folks to help with enrollment and eligibility. The number you're welcome to call is 510-460-3800. Dial that number and the tree will direct you to the right place. If you have any questions that are not an answer, let me give you my extension. It is area code 510, yes. Did I say 512? I'm sorry, I moved from Texas, so I'm still stuck on the old area codes. 510-460-3800. If you need a question answered or you'd like to talk with me about, this process, please do. My number is 510-650-6090. In closing, I could stand here and talk a lot about the work that Tiburcio Vasquez does in the community, and it is our responsibility to serve you and to work with our partners. Our local electeds are very supportive of what health centers do. But all the problems that are part and parcel to what this new legislation is intended to resolve will not be solved overnight. But what I can assure you is that those of us that are commissioned and committed to working with patients with their pediatric needs, their geriatric needs, their mental health, their adolescent needs in terms of their health care, we will continue to be in the position where we leverage our funding, our relationships, that we will partner. We're very grateful to have a marvelous partner in the county who funds us for the Health PAC program. In addition to our federal funding, we have local funding that pays for care. But what it really boils down to it, we are your neighbor, and we do want you to reach out to us as a local nonprofit funded through the gifts and donations of many families, but also through the revenue we earn by seeing patients. All of that goes back into our system so we can be the safety net provider and be the provider of preventive care that we really dream and have been for these many years. So with that, I'll leave it, and I know you have questions to ask of us, and if you have, again, any questions, please feel free to contact through those numbers, and we have a table outside. We can answer any additional questions from our perspective. Thank you very much.
Thank you, David Vliet. Thank you, Herb. Thank you, Alex. And of course, thank you, Bishop Macklin. And now I'm going to offer, if anyone would like to ask a question, raise your hand. We're going to give you an index card with a number on it. My staff is walking around with index cards, and we'll just take them in groups of 3, and then I'm going to direct them to the panelist if they have an answer on whatever you're asking. So let's do that. If you have index card number 1, 2, and 3, why don't you stand up? So index card number 1. Go ahead, ma'am. Okay, thank you, ma'am. And number 2.
A couple things. One, why right now they say we're supposed to get 30 million people on the health care. Guess what? There's going to be 30 million people getting kicked off of health care too. By the CBO. That's done by the CBO. Where do we say? The thing is, you're kicking some people off and putting other people on. Also, senior citizens. I hope anyone here doesn't have to go through what I did with my dad. The thing is, what's going to happen with senior citizens with that board of health care, the 15 people on it, my dad got to the point where one doctor would not serve him. So one out of his office said, I will go ahead and treat you for the rest of your life. He had 85 blood transfusions in 11 months as a result of one of the doctors. But the thing is, when it gets to the health board and the health board says, hey, this doctor doesn't want to treat you, what's he going to do? Say, hey, I'm kicking you off. You're not going to get treated. That's what's going to happen to senior citizens. Well, I hate to say it, but I see it coming.
Appreciate that. Do you have a question or you're
Just basically, why? How are we? Math does not add up. 30 million on, 30 million right now is on health care, not receiving health care, and CBO says there's going to be 30 million not receiving it after a long-term after the quarter care.
Okay, thank you.
Those numbers don't add up.
Number 3, question number 3.
Over here.
How you doing?
Hi, fine. My name's Antoinette.
Hi,
And my
Antoinette.
question is, I know that due to Obamacare, you can no longer be disqualified for a pre-existing condition. But what I want to know is, due to a pre-existing condition, can they raise your premiums? Can they increase your premiums?
Okay, well, thank you, Antoinette. Let's start with the third question, actually, because Herb, I think you alluded to this, and then why don't we take it, can your job drop your coverage? There's some questions that are out there about the Taft-Hartley plans, if your union has a Taft-Hartley plan, and then the third question, we'll take the second question last, which is it true 30 million will now have health coverage, but that's at the expense of 30 million who will not?
Okay, on the third one, on pre-existing conditions, the deal is that you can't be denied and you cannot be charged more because you have a pre-existing condition. The only factors that can determine your premium are your age, your geographic location, and your family size. So they cannot, if you have had, say you've had breast cancer, and you've been, you've gotten through it and you've recovered in the past, they could still say you have breast cancer and they could deny you or charge you more. Cannot do that anymore. On the one around 30 million and 30 million off, I think this is a misinterpretation of what CBO said. There are up to 30 million new people who will get coverage through the health insurance marketplaces, and up to 17 million across the country that will be eligible for the expansion of Medi-Cal. That's a state decision, and California is expanding Medi-Cal. When you talk about 30 million off, you may be talking about undocumented individuals. Maybe you're talking about people whose work won't provide health insurance coverage, but they will have the ability to get every American, regardless of whether they will get coverage. The issue is if their employer does not provide them coverage, they can then go to the marketplace as an individual. On the job coverage in Taft-Hartley, the congressman is right. That is a private negotiation between your employer and the labor union. Labor unions want you to have coverage, and if for some reason your employer and a union doesn't come to an agreement, then you could have another way of getting health insurance. But a labor union and an employer typically come into an agreement of a relationship, and therefore you get insured through your employer.
Let me go to numbers 4, 5, and 6.
I would like to say that we're a Medicare provider, so for those folks that are looking for a medical home that have Medicare coverage, we can accommodate and certainly would welcome that. Welcome them.
Great, thank you. So question number 4. How you doing, ma'am?
Hi, I just came from the Covered California's educator certification program, so I'm really for the Covered California's effort. However, I think to change this culture of not to have the insurance to everybody should have, and it's a right to have it. We should have some educational system in place, and I haven't seen any possibility because probably, you can see we don't have any kids here, and kids are the ones who need to be educated. So is there any possibility to have the program in, for instance, high school?
Great question. Question number 5.
My name is John Liedall. I'm Executive Director of some health centers over in Bayview, Hunters Point. I heard a rumor this week that Medi-Cal is, because of ACA, Medi-Cal is going to restore dental restorative work as part of their program, which is fantastic if it's true.
Great, number 6.
Yes, hello there. I am a licensed agent that works at Transamerica, and we just rolled up a new program that allows people with insurance policies to have a long-term carrier rider on it. And I just wanted to know, will this affect? Could it be a benefit for a lot of the clients that we deal with?
Great. Now, do you want to? You can pick the order. Go ahead.
I'm going to do the 4th and the 6th, and Alex said he was going to do the 5th, and you might want to do the 5th on dental, or? Okay. On the 4th one, in Obamacare, I mentioned that these are communities educating communities. And so there are hundreds of organizations, community-based organizations, organizations of providers, including physicians in your area, small business associations, who are all contracted to be doing the same thing that the congressman is doing here today, and that is to outreach, to educate, and actually to help you enroll. And that goes for everywhere from schools to faith-based institutions. The community health centers, we have provided additional grants, $22 million recently, to California's community health centers for them to do that education and outreach. All of that is starting now, and we are working, as is Covered California, with elementary schools through community colleges, through universities, and they are required to do that. As a matter of fact, I think there are going to be 21,000 assisters across the California in several hundred organizations in your community speaking 13 languages that will be able to provide that information, including what we can in the congressman's office and my office and Alex's office and everything else. The other is in terms of the agents and brokers. Agents and brokers play a huge role, and agents and brokers will continue to educate, and people can go to agents and brokers as opposed to one of these community-based organizations or register online. Long-term care is not a benefit in the commercial marketplace. The state legislature passed a long-term care services benefit that would go along with Obamacare, but they have to ask federal government approval, and they have not gotten that approval at this time. Alex was going to do that.
Yeah, well, I'm glad to say that, in fact, the rumor is true, and beginning in May, we will see the full restoration, Alex, of adult dental. So that happened legislatively over the past summer.
Yeah, and just one of the great benefits of the Affordable Care Act, to that last thing, people don't remember, but when it passed in March 2010, the state was broke. And it was looking at slashing the Medi-Cal program. But it couldn't, because the Affordable Care Act drew a line in the sand in March 2010, the eligibility level you currently had. People don't get what an incredible saving thing this was for the Medi-Cal program in California. But at that time, lengthen the line, thin the soup, right? California couldn't cut the eligibility levels as many other states had done in the previous 12 months, but they could cut the benefit load. So 5 benefits were eliminated from the Medi-Cal program over the last 3 years. Acupuncture, optometry, dental, adult dental, and I'm forgetting the other 2 at the moment, but adult dental was the key one. That was the huge one, and it's crazy, a health benefit without dental. And so it's great news that it's been reinstated, fully instated in May. Quickly on the outreach piece, to the woman's question around how we're doing in schools, yes. And other counties ask us all the time, how did you get almost 50,000 of your 56,000 people enrolled? And we say one simple strategy did it. Point of service enrollment. Get enrolled where you get care, right? So no one's going to go stand in line at a self-sufficiency center for 4 hours, it's not a great strategy. But when you go to the doctor or therapist that you have a therapeutic alliance with, that's where you make hay in enrollment and eligibility. That's why Tiburcio has been one of the most successful enrollment places, much better than the county enrollment centers. So we really encourage anyone, if you're sick, tired, or hurt and you need care, go get care, and while you're there, get enrolled. Because all of the 911 receiving centers and all the community health centers can do so.
2 other quick things, because we had providers in the audience. One is that in this Medi-Cal expansion, the federal government is paying 100% of that cost. And as Alex and I said, there's 1.4 million Californians who are eligible for that, and we're paying 100% of the cost. But what's also important is starting this year and going next year, for any primary care providers that accept Medi-Cal, they are actually getting a huge increase in their reimbursement. They're getting the Medicare rate, which Medicare pays far greater than Medi-Cal does. So it's a way to make sure that in our communities, those who are getting the Medi-Cal benefit will actually have many more providers to help them undertake that. And on the community health centers, and specifically on the school-based health centers, the Affordable Care Act is what put millions of dollars into the school-based health centers, and I do think Alex and all of you here in Alameda County are the leaders nationally in using those dollars to make it work.
Great. Let's take questions 7, 8, and 9. So if you have index card number 7, great. If you don't mind standing up, sir.
Hi, I'm John Guerrero. Your second speaker actually hit upon what I thought should be the most important thing here. The Alameda County is from 2006, I guess, to 2010. You said more people were becoming uninsured. And probably one of the reasons for this, if you look at the BLS, is that more people are becoming unemployed. Alameda County, since 2000, has been downtrending in its employment rate. Not employment rate, but number of people actually employed. And as Alex pointed out, poverty kills. Poverty is probably the worst health impediment to any place, to anyone. So if you can provide any kind of insurance you want, you can provide all the health care you want, but if that person is poor and he does not have a job, he runs a higher risk of getting sick and dying earlier than anybody else. So that, I think, is the most important thing that we should be addressing here. Not only does it make everybody happy when they're employed, it makes them healthier. So employment should be the very top of your list of what we should do here, not only in Alameda County, in California, because California essentially is flatlined, as opposed to Texas, Oklahoma, North Dakota, even Alaska. They're all going up. The number of people being employed is going up. It may be wiggling, but it's wiggling in the up direction. California has flatlined. Alameda County is trending down.
Thank you, sir. Question number 8. How you doing, ma'am?
Hi. Some of my question has been already been answered, but my question revolves around the premium adjustments and subsidies. The question is, how do I prove that my income is below, say, $32,000? So I called the covered California, and I asked them. And this nice young man said it would be based on 937 of the AGI, just frozen in your taxes. And I listened to the previous year. Okay, so this year, I had an information. And so I said, well, how do I prove that my income is less than, let's say, 32,000? Well, I would have to say an income, my pension, my social security tax, or whatever. And then I asked him, well, how is that going to, how is my subsidy going to be credited to the insurance program I get? And he said that I can take it off the tax credit, or it could be sent to, let's say, Kyle. So why would I want to wait till the end of the year to get that tax credit? Why doesn't it just go right to Kyle? So that's kind of the question. How are those premium adjustments going to be handled, and why do I have to prove that my income is below one of your targets?
Great question. Thank you. Index card number 9.
Hi, I'm a public school teacher, and my employer offers insurance, but the out-of-pocket premium is astronomically high, especially to insure my family of 3, myself, my husband, and our son. And I'm wondering if I can opt out of my employer's insurance and look at the Obamacare for our family.
Also a great question, and thank you for being a public school teacher. You want to start with that, Herb?
A couple different things. If you are employed and the coverage that you have, that you pay less than 9.5% of what you earn on your premium, your employer meets that bronze level. In other words, you're limited to 40%. They have to pay 60%. So if they do that, that means that they are providing you an affordable product. So anybody is free to go and use Covered California, but if you were to say, I just have decided because of this plan, I'm going to go to the marketplace known as Covered California. If your premium is deemed affordable, again, because it's less than 9.5% of your annual income and it meets that minimum value, you can get your coverage, but you won't be eligible for the advanced premium tax credit. If your coverage is unaffordable, and that means that if you as an individual, it's an employee only, your premium is greater than 9.5% of your income, or you don't have a plan that meets that value. Now, we think that most employers will try to meet, affordability, but if it's unaffordable, and say yours happens to be in that 9.5% test, then you could go, and if you were between that $16,000 and $45,000 or $33,000 and $92,000 if you were in a family of 4, you could get that subsidy. But nobody, has to get their coverage through their employer, and you always have a right to go. It just depends on whether your coverage is affordable or not. And there is a calculator on Covered California's website that can help you on that. In terms of the premium adjustment that you mentioned, I'm a little baffled by their response because one is you're asked what you think that your prospective income is going to be. And then on the back end, there is a federal hub that was built, and you're absolutely correct. Your whole tax form doesn't go over, just your one adjusted gross income goes over. If there's a question about why your income is so much, say, lower than what you ended up making, then they would, on the back end of that, maybe ask you for some documentation. But you should be able to go on the Covered California website or apply in person, be able to give what your projected income is. Your premium assistance or subsidies would be based on that. You should, if you lose your job or you make more money during the year, you should always call Covered California and tell them, because it'll get reconciled on your taxes. So if you think you're going to make less money, they will immediately give you a greater subsidy. If you think you've got a promotion, you're making more, you want to take that into account or you're going to owe a lot of money. But on its face, you should be able to just give what your income is, it comes over on that, and then if there's any question, you should be able to then reconcile those at that time. And you are correct, the reason that we call it advanced premium tax credits is because for most people, why wait and get it back on your taxes? Let the federal government give that payment to Kaiser, and then instead of, say, being charged $300, you're only paying $130, numbers out of that. But yes, if you say you're eligible for this premium tax credit, you will be able to choose and say, I want it advanceable. And so you'll pick your plan, and when Kaiser bills you, they'll be billing you your premium, which is based on the rate minus the assistance you get, and you will pay that amount when you're billed every month by Kaiser.
Anyone else want to add to this round? And I'll also say our office is happy to help out with those premium adjustments. If you're having issues, let one of our staff members know. All right, I'm going to take questions 10, 11, and 12 now. So if 10, 11, and 12, raise your hand. I'll be happy to address them.
Okay, I have a question here. I'm already on the Medicare. I'm paying the premium for Plan B. So what happens for me now, me and my wife?
Great, thank you, sir. And number 11.
I've got two questions, if I may. I'm hearing a lot of this whole act being called the Affordable Care Act. But mostly what I'm hearing is, how can we come up with more money to pay for certain services that are out there? There's a lot of pharmaceuticals that it's not uncommon to see 1,000% increase on what it costs to actually make the drug, to actually put out there. So they're overcharging and they're price gouging a lot of people. Is there anything that's being done as far as we're looking at providers of drugs or parts. My dad, the other day, I was in the doctor's office, and they're putting a part, and for a little 5-centimeter screw, it was $500. And that's just ridiculous. And so there's a lot of this going on throughout the healthcare industry, but I think there's not as much attention being put towards where we can reduce the expenses. Instead, we're trying to come out of ways so we can come up with more money to continue paying those outrageous prices. So my question is there anything being done on that side? More importantly for me, my second question is, I don't believe in pharmaceuticals as being the cure for health. So I am not into conventional doctors, which I'm a firm believer in naturopathic doctors. My parents were on a lot of prescription drugs. Their health was really low. When we switched to a naturopathic doctor, they got off a lot of their prescription drugs, and their health increased. The only problem is, no naturopathic doctors are covered under this Obamacare. Why is that? Is it because they do too good a job and they're going to get people off of more drugs and it's going to take money out of the pharmaceutical companies? That's not right. They should be included. If I'm going to be forced to pay into an Obamacare system, I should be able to go to the naturopathic doctor that I choose.
Great, thank you. And question number 12, please.
One of the questions I'd like to ask is that I have a lot of elderly family members, and some have HMOs, some have PPOs. Now with Obamacare, I noticed some of these individuals in my family are paying high premiums because they have pre-existing illnesses. And they have insurance like HealthNet, the Blue Cross, United Healthcare. Some are paying like $700 a month for their premium. Now, will their premium come down with the Obamacare? Or since they have an HMO, will they still be able to see that same physician that they're seeing now, or will they have to change physicians because of Obamacare?
Great, thank you. Also a good question. You want to start with that one?
A couple different things. Under Covered California, they have chosen 12 health plans across California who have put together their networks of hospitals, their networks of physicians, and other types. And so they are offering HMO and PPO plans, but for those that want to look for coverage in Covered California, they're going to need, when they look at their choices, to see if their providers are in that network. But that's a negotiation between a health plan and theirs. So in some cases, probably yes, there's a lot of providers in the network, but I can't say between what plan. There's just hundreds of plans and thousands of providers. Was there a follow-up to that?
Right.
Okay.
For instance, you have Hill Physicians Medical Group, you got Brown and Tolan. And so what if the individuals come under Brown and Tolan, but what if they doctors under Hill Physician Medical Group, then all of a sudden with Obamacare, they have to go to Brown and Tolan, which that particular doctor is not in a medical group, so what's going to happen then?
It's actually not an Obamacare issue. The issue is who the insurer. So let's take the case of Aetna or HealthNet or whoever it happens to be, okay? The state law is that they have to provide a network of providers, so physicians et al. Could be the medical group that's got physicians and specialists, okay? They have to pass muster at the state level. You have to have a network of providers that will be able to see everybody for primary care, handoff to specialty care. So that's not Obamacare. What Obamacare says is you need to have choices of who can provide your health insurance. And so that's a conversation, again, between the insurers. They put the networks together. And so when somebody goes on the website to choose, that's exactly, you're hitting the nail on the head. That's the exact question that they need to be asking is, I have Dr. Smith, okay, and I had Hill Physicians Medical Group, but I see you're using Brown and Tolan. Well, most physicians actually are in both of those medical groups. You don't have to just be in one. So they do have to ask the question, I like this plan, but I want to make sure, same as I used the example before for me. I'm a person living with HIV, okay? Cedars-Sinai is not in the network of the plans that I would get to choose if I were to use Covered California. So I would have to go a different way. So it's a very good question. And remember, on the pre-existing conditions, they cannot deny you and they cannot charge you for them. So they are likely through that to come down. On the Plan B and on Medicare, stay on Medicare. The exchanges, marketplaces are not for people who are on Medicare. So if you're on Medicare, you stay on Medicare as a part of that, and it's the usual thing. The naturopaths, let me make one comment, because this has been an issue huge, and I work a very significant amount with the California Naturopathic Association, and I've worked with those docs on that. It's really based on state law and what the insurers want to be able to do, because insurers can decide who they want to put in the network based on their scope of practice. And I can tell you that there are states like Washington State that are allowing naturopaths under their scope of practice to be in the networks of these insurers that people are choosing. And I don't know yet, because we've not seen the networks of Covered California, I don't know yet whether any of those insurers are going to include naturopaths, but I can tell you, been one of those people that have been encouraging them around chiro, acupuncture, naturopaths and stuff. But that's a decision based on what they can provide by way of services and the insurance company.
Okay, I have been informed by our gracious host. This will be our last round, and I know Alex Briscoe has to go. Thank you. I want to thank Alex again. So let me take 13, 14, 15. I'm sticking around. I know some of our panelists will be sticking around. We'll be available. You'll find me over at the dental screening area. So go ahead if you're question number 13.
Okay. Right. First of all, I want to thank you. Very, very well done. And thanks for letting me know that I'm in great shape. I have Medi-Cal and I have United Healthcare. And because of the Affordable Act that's going in, United Healthcare informed me that my premium went down $150 a month.
Thank you for sharing that with us. And let's go to number 14.
Good afternoon. My wife is in a nursing home, and she was on Medicare and took a big procedure to get on a Medi-Cal. And between the two, I thought both would cover most expenses. Sometimes expenses come out between the two, and I was wondering, is Obamacare going to have anything at all to do with while you have both of them?
Why you would have both Medi-Cal and Medicare?
No, are they going to have any impact? If you already have both of these two, they're supposed to be 80% and 20%, and they're supposed to be covered. But there's still some expenses come through. And I want to know, is Obamacare going to have any impact on these extra expenses I have sometimes?
Okay, great. And last question, number 15. If you have question 15, please stand up, or if you want to pass.
I have a question is, what if individuals, they don't have medical care right now, and then they have limited English language, capability? How about the program have any plan to reach these populations, such as whether they have to wait till, because the Obamacare is going to be implemented next year. So it's going to waiting for year 2015 to claim the tax after April for that year and then find out this information, or have any plan to reach population like this group? Because I have seen people, they work in the restaurant, they maybe not speak English, or somebody working as a babysitting to taking care of somebody's kids, and this or the clean maid clean somebody's house, so they don't have knowledge about this. That's my question.
Great question.
Thank you.
We live in one of the most diverse areas in the United States, so that's very appropriate. So go ahead, Herb, if you want to take those two.
Let me take the Medicare, Medicaid question first. That's a shorter response. There is a very significant program in the Affordable Care Act that addresses exactly the issues you're talking about, the dually eligible for Medicare and for Medi-Cal. It has not kicked off yet, but it is a program that Alameda County is one of the 8 counties, and it is designed to try and provide better care, more comprehensive care. You know, Medicare and Medicaid have a lot of similarities, and yet they duplicate, and therefore a lot of money for that duplication, and more should be to help your wife improve in her care. I'll give you a copy of my card. I'm very happy to sort of connect you and provide you with information. But there are over 1.4 million individuals in California who are both dually eligible for Medicare because they are post 65 or people with disabilities permanently disabled, and are also on Medi-Cal, and they're a very important part of the population. So the answer is actually yes. In response to yours, there are in Obamacare things called navigators or outreach organizations. And there is a requirement that every state that runs its own marketplace, like Covered California must provide outreach, must provide education, and must provide enrollment services through community-based organizations in 13 different languages. There's a standard that was based on California's far-reaching standards for language access to make sure that culturally and linguistically people could understand. So there are organizations and community groups beginning in around mid-September, so another week to 2, who will start getting through the county and providing that education and providing it in, I know, Chinese, in Korean, I think Japanese, I think Tagalog, I think Hmong, a number of languages as well. And we can provide you that information on Covered California and how to find that information.
Great. Well, thank you again to our panelists. And sir, some of the panelists have to leave, so I'll walk out. I'll take questions, and some of them will take questions with me.